There are two broad categories of incontinence in women. One is what we call stress incontinence, and the other is urge incontinence. Now, stress incontinence is related to additional pressure on the bladder that is more than the outlet pressure. So, for example, if we cough, when we sneeze, we laugh, there's a lot of intra-abdominal pressure, and it compresses on the bladder, and the outlet pressure may not be strong enough to hold the urine, and you leak. And this is commonly seen in elderly women or women who have gone through some pelvic surgery or who have given birth to many children. The pelvic floor is lax, so they tend to have this stress incontinence. Now, urge incontinence is different. Urge incontinence is related to a very sensitive bladder. So they have this frequency, they have this urinary urgency. They feel that they need to go and pee. But before they can reach the toilet, the bladder contracts very strongly and they leak. So that's called urge incontinence. So the treatment of these two types of incontinence is different. Urge incontinence, basically there's no surgery for that. So we treat medically. We give medication to stabilize the bladder, to keep the bladder quiet, so the patient will not have this sense of urgency. We make the bladder less sensitive. So it's a non-surgical approach. And then there are certain triggers that can make this urge incontinence worse. For example, if you are very stressful, you take certain food or drinks that has like caffeine containing, like coffee or tea, can make your bladder very sensitive. So our usual advice is for patients to minimize coffee drinking, manage their stress, and usually things improve. So we give medication plus some lifestyle changes. Now, when we come to stress incontinence, we can start off with a non-surgical approach by asking them to do pelvic floor exercise. Another word for that is Kegel exercise. Basically, they squeeze the anus. Now, the anal muscle is linked to the pelvic floor muscle. By squeezing the muscle and count to 5, 1, 2, 3, 4, 5, relax. And that's counted as one time. In the day, they do more than 100 times. Not while they are peeing or pooing. They do it when they're reading a newspaper, they watch the TV. They can do this exercise. It strengthens the pelvic floor muscle, and that will improve drastically the stress incontinence. But if they have done all this, and yet they still have significant stress incontinence, they need some kind of surgery. And usually we will use some kind of a sling or tape to sling up the bladder neck, and usually that will fix the problem.